A very good morning to all of you. I am clinical sexologist, sex coach, and sex researcher Dr. Uttam Dave, and I welcome you to Sex Problems and Solutions. If you are somebody in your 20s and experiencing a lot of erectile difficulties, and what I mean by erectile difficulties is when you go to your girlfriend and you're not able to get an erection, or uh, you are able to get an erection but not able to sustain it, then those difficulties would come under the category of what is sexologically termed as erectile dysfunction. Earlier it was called impotence, but now we don't use that word anymore. Now, so many men in their 20s are struggling with this problem, and I can understand that being a man, it is very, very difficult for you to talk about erection problems with your friends because they're likely to make fun of you because they do not understand the seriousness of the problem and they take it very lightly and make fun of you. At your own personal level, you may be very, very embarrassed when you see that your penis does not become hard when you are with your girl, or sometimes it becomes hard but it softens very, very soon, or sometimes you are so frustrated at your own problem that you don't know what to do, and sometimes that may make you just avoid sex completely by making excuses. Now, these are the things which are very, very normal when a man experiences sexual problems like erectile dysfunction. But is this a solution to your problem? No. If you think that the real problem lies in solving the problem in a real way, then this is a video for you in which I'm going to discuss about some aspects of sexual dysfunction, which is erectile dysfunction in this case, and what you can do about it. So continue watching this video if you're facing the problem of erectile dysfunction and you are in your 20s. Now, you have to understand one thing, that basically an erection problem can arise out of two causes: physical causes and uh, causes related to your mind, which would be your thinking and also your feeling part. Now, if you are somebody who thinks that just taking a going to a nearby chemist and asking him for uh, a pill will help you to solve your problem. Yes, it definitely help you solve your problem, but that can be compared to something like whitewashing something. The wall is bad, you're whitewashing it to avoid the bad exterior. But then what happens when that bad exterior is removed? Again, the wall remains the way it is, right? So it is like treating a wound just superficially but not treating the wound completely. Now, coming back to what I was saying, is there are two main causes of erectile problems: physical causes and mind related causes. If you're somebody in your 20s and not having any physical problems, then your erectile dysfunction is likely caused by emotional problems and mental problems. And for that reason, I always suggest that if you are having the problem of erectile dysfunction, please make sure that you analyze the cause of the problem and then take a treatment accordingly. So, if you're somebody who's experiencing erection problems but do not have any physical problems, then it's time to see a clinical sexologist who will assess what exactly is wrong uh, with your mindset, which is causing this psychological sexual dysfunction, I would say. You can take an appointment with me on any day between Mondays to Saturdays, evenings 4 to 9 p.m. And to take an appointment, you can contact me on 99206 55464. And I can assure you that once you can identify the main cause of your erectile dysfunction, it's very, very easy for you to manage it not only in short term, but in short term, middle term, and in long term. Because at the end of the day, you don't want a whitewashing of your problems, but you want a permanent solution to your problems. Thank you, and I hope to see you soon at my clinic.